At 2:17 a.m., the fluorescent lights in OR3 hummed at a pitch that climbed the back of the skull. Dr. Kira Shaw scrubbed in with betadine that stained her wrists the color of rust. Heat rose off the sink. Steam kissed her mask. When she reached to turn off the water, the cuff of her scrub top rode up. 12 small tally marks and a set of coordinates surfaced on her right forearm, dark against damp skin. Dr. Malcolm Pierce stood at the counter, already gowned. His silver hair looked arranged by a ruler. His eyes did not move off the tattoo. This is an operating room, not a bar. It stays covered, doctor. Hospital policy was not what I asked. Kira dried each finger with a crisp towel. She did not look at him. Understood. Nurse Gloria Reyes stood between them at the instrument table. 23 years in the same blue clogs. Her hands arranged clamps like chess pieces. She said nothing. She saw everything. Inside the theater, the patient was draped and quiet. Mary Ellen Cates, 67, scheduled cholecystectomy. Dr. Ahmed Farouk's voice was calm behind the anesthesia screen. Pressure 142/88, heart rate 91, oxygen 97. You are observing tonight, Pierce said as he walked past Kira to the field. Gallery only, no interruptions. Kira climbed to the glass rail that hung like a balcony over the light. From up here, bodies turned into geometry, angles of elbows, lines of suture. The buzz nagged in the lights and settled behind her ears. She watched the monitor more than the hands. The numbers drifted a little, not much. Enough to be a direction, not a point. Temperature rising by fractions. Breaths shallow, measured like someone counting in their sleep. Pierce cut skin with a steady stroke. He worked with textbook hands. Bleeders flashed and went quiet. Gallbladder inflamed, not dramatic. The field looked clean, too clean in one corner. The tissue around the duct held a color that was not the color it should have been. Not red, not yellow. A tired gray. Kira leaned into the glass. The hair at her neck prickled. She keyed the mic. Dr. Pierce discoloration near the common duct. Her voice stayed level. She could feel the air go colder when she said it. Could be deeper infection. Observe means quiet, Dr. Shaw. Gloria's head lifted a half-inch at the table. Farouk adjusted a knob without comment. Kira stepped back. She let the humming lights fill the space where words would have been. She tracked the vitals. The heart rate nudged up past 100. Oxygen held. Not a crisis. Not yet. The procedure ended clean. Clips placed. Irrigation clear. Closure as neat as handwriting. Mary Ellen rolled out under warm blankets at 3:41. Kira followed at a distance that made her invisible. In recovery, the room smelled like disinfectant and leftover coffee. A young nurse named Marcus tapped in notes with his foot braced on the base of the bed. Mary Ellen's cheeks had a film of light sweat. Her lips looked a shade dim. Kira watched the monitor tick. 1 minute. 2. Temperature 101.3. Pulse 127. Blood pressure sinking toward 94/58. The screen gave a soft alarm that sounded like a sigh. Kira did not call first. She moved. Second Ivor. Blood cultures in 2 labeled vials. She ordered broad-spectrum antibiotics, her voice flat and practical. She asked for a portable CT. The nurse blinked and then hustled because her tone left no room for other ideas. By the time Pierce walked in, Kira had the CT requisition open. "What did you do?" he said, more tired than loud. "What needed doing?" she said. "She's trending into septic shock. There is likely a posterior abscess, not visible during the scope, behind the hepatic flexure. You do not have authority to order imaging. She will not have 2 hours if we wait for authority." Their eyes held for a full beat before the CT technician eased the machine up beside the bed. The world narrowed to the slide of the gantry and the slight tremor of Mary Ellen's hand under the tape. Images printed in gray on the screen. Abscess, 4 centimeters, exactly where Kira's eyes had been looking through the glass. They took her back at 5:34. Pierce scrubbed again. He drained. He placed 2 dark drains that curled like snakes into the wound. He debrided tissue that did not want to be touched. Farouk's voice stayed even. Gloria passed instruments like she had already read the next page. Kira watched from the door with her hands at her sides, the cuffs pulled low. She counted breaths without meaning to. She felt the itch begin under the ink on her forearm. It always started when the room tilted toward the edge. At 7:15, Mary Ellen's numbers drifted back to steady water. Pressure climbed, pulse softened. The fever loosened its grip. Pierce closed with precise bites and neat knots. He loved closure. Kira understood that about him. The hallway outside the OR tasted like metal and antiseptic. Kira leaned her shoulder against cool tile and let the noise wash past her. A gurney wheel squealed somewhere. A phone rang 3 rooms down and then stopped. Noah King from the ER passed with a tablet against his chest sleeve, high enough to show a faded unit patch on his shoulder. He took her in with a quick look that cataloged more than most people did. He paused half a step, thought, and kept going. In the residence lounge at 6:45, the coffee had boiled too long. The couch had a sag in the middle that swallowed spines. 2 second years drifted in whispers over their paper cups. Did you hear about Shaw? 30-something starting over. She called sepsis before Pierce did. Lucky guess. The words had the bright edge of gossip and the dull edge of fear. Kira did not stop. She had 12 minutes on the clock that no one could take. The attending locker room held the hush of tile and scuffed benches. Kira sat. The itch under her tattoo sharpened into heat. She pressed her sleeve down and told herself it was just skin. The marks were for 12 men whose names stayed warm under her hand. Coordinates for where the world had shifted under her feet. She was not in those places now. The fluorescent hum still sounded the same. Her phone buzzed against the bench. See me before rounds, Pierce had texted. She closed her eyes for a count of 5 that felt like diving. Then she stood. His office was glass and dark wood. Diplomas lined up in a pattern like marching orders. He kept the blinds open even on nights. Austin's skyline sat gray and patient outside. Close the door, he said. Yes, she did. Mary Ellen Cates is stable. She will recover. His voice had no relief inside it. Good. You countermanded my post-operative plan. You administered medication without attending approval. You ordered imaging without my sign-off. Protocol requires intervention when sepsis is suspected, she said. The words were clean enough to cut. Do not teach me protocol. He leaned on his desk with his palms flat. He did not sit. What I want to know is how a first year with 6 weeks in this hospital recognized a posterior abscess that did not show on pre-op imaging and was not visible during surgery. I have worked in underserved clinics, she said. Limited resources. You learn to read patterns. Where? Various places. That is not an answer. It is the one I am giving. Silence spread across the room and tried to make itself comfortable. Pierce tapped the desk once, a small sound that did not fit his face. You are technically excellent, he said finally. Your sutures are unusual but effective. Your instincts are beyond your training. You are also evasive. You do not socialize. You carry a tattoo I told you not to show. Kira did not blink. I do not like mysteries in my department, he said. I like competence and I like transparency. So here's what happens. Keep your head down. Follow protocol. Do not make me look incompetent in front of my staff. Understood. Cover that tattoo. Kira held his eyes a second longer than was polite. Then she let them go. She turned and put her hand on the door. When she reached the hall, the hum of the lights returned like a familiar ache. She checked the time. Rounds in 12, enough to breathe, not enough to sleep. She moved past the lounge without looking in. Voices wavered and then fell off as the door swung shut behind her. Her pager buzzed against her hip. The small plastic clicked in her hand. She read the message. See me. Now. The pager's screen glowed in Kira's palm. See me. Now. She cut through the corridor at a fast walk. The floor's wax reflected ceiling light like a thin river. Pierce was already standing by the door of his office when she arrived. He did not invite her to sit. Rounds in 10, he said. Before that, an evaluation. Emergency has a 14-year-old. Skateboard crash. Abdominal pain. Vitals stable. Go look. Write it up. Page me if anything is actually concerning. He did not wait for a reply. The conversation ended with the click of his pen. Emergency was bright and loud, the air smelling of antiseptic and coffee, and something copper under it all. A boy lay on a gurney with a blanket bunched around his waist. He stared at the ceiling like it was the only thing that would not move. His mother stood near his shoulder and held her purse against her stomach with both hands. I am Dr. Shaw, Kira said. What is your name? Ethan, he whispered. Tell me where it hurts. He put his hand over his left upper abdomen. Here. It felt like he was gauging her face more than the pain. His lips were a shade too pale. His skin had a cool, powdery look. She watched the monitor. Pressure 118/72, heart rate 98, oxygen 96. She listened to his chest. Air moved, but he was breathing shallow, like he was trying not to jostle something inside. She pressed lightly across his belly. The left side made his muscles flinch like a reflex he could not stop. Guarding. Her nose caught a metallic note beneath the disinfectant, faint and wrong. "How hard did you fall, Ethan?" "Hard," he said. Could not get up at first. Thought it would pass. "You are going to be okay," she told his mother. "We will keep a close eye." Kira stepped into the hall and paged Pierce. He answered on the fourth ring. "Shaw, make it quick." "Left upper quadrant tenderness. Guarding." "Vitals currently stable. I think he has a splenic rupture with possible small bowel perforation. He needs surgery now. Standard for blunt abdominal trauma with stable vitals is observation and repeat imaging in 6 hours." He said, "Monitor and document. Page if he deteriorates." The line went quiet. The hum and the lights filled the space where an argument could have gone. Kira put the phone away and dragged a stool to Ethan's bedside. "We are going to keep you very close," she said simply. She stayed. Minute by minute, the numbers marched. At 11:47, the blood pressure started to slide. At 11:51, the heart rate climbed past 120. Ethan swallowed hard and pressed a hand to his throat. At 11:53, he turned his head and vomited blood into the basin a nurse was already holding under his chin. Kira pressed the code button with the heel of her hand. Her voice cut clean and simple. "Operating room now. Type and cross 4 units. Large bore IV. Call anesthesia. Move." The room clicked into a different gear. The mother's breath came in a little gasp that dropped into silence. The nurses moved fast, efficient, no wasted steps. Noah King appeared at the foot of the bed without being called, already pulling gloves on. He glanced at Kira, and something in his face said he understood the speed she was asking for. They were in the operating room at 12:04. Farouk placed the tube while Kira prepped the field. Pierce came through the door a minute later and scrubbed on the run. The first incision opened, and the smell of blood rose warm and metallic. Red filled the suction line. The spleen was torn and fragile. The small bowel had a perforation tissue thin and weeping. "Hold pressure here," Kira said to Gloria. Her own hands moved with economy. The monitor line stuttered. Pressure dropped. The beep skittered and then flattened. The room hiccuped. Farouk's voice went quieter and quicker at the same time. "We are losing pressure." "Scalpel," Kira said. "DeBakey, Pringle, now." Pierce looked up like a person snapped from a dream. For a fraction of a second, his hands did not know what to do. Gloria had already placed the clamp on the tray. Kira slid a finger, found the ligament, and clamped the hepatic artery to slow the flood. The red in the field dulled by degrees. It was not elegant. It was necessary. She packed the splenic bed. Not the standard square count and weight. Tight directional where the vessel would protest the most. She ran sutures on the bowel in a pattern no one at Franklin had been trained on in residency. Crosshatch. The needle moved with a rhythm like handwriting she had practiced a long time ago. Her eyes did not leave the tissue. Her hands did not tremble. "We have electrical activity back," Farouk said. "Pressure 86/52, climbing." Kira tightened the last knot and checked for leaks. The field held. The room took a breath as if everyone had been underwater. "Where did you learn that?" Pierce asked. The question came out quiet. It did not sound like a challenge. "Training," she said. The word hung in the air and did not explain anything. They closed. Gloria's eyes flicked to the stitches and then up to Kira's face. She did not say what she was thinking. She did not have to. In the scrub room, the hot water came out in a clean sheet over Kira's hands. The warmth soaked into knuckles that had worked past fatigue. Noah stepped in and leaned a shoulder to the tiled wall. "You just saved that kid when the plan was about to go the other way," he said. He did not make it a compliment. He made it a fact. "The surgeon saved his life," Kira said. Noah's mouth quirked without a smile. "I was Navy corpsman in Helmand. I know combat medicine when I see it. Those stitches, that packing. The way you did not hesitate when the monitor went flat." "You should get back to your station," she said, pulling a paper towel. She dried each finger and the spaces between like she always did. He watched her do it, then pushed off the wall. "If you need a set of hands that understands what you are doing, you know where I'll be." In the residence lounge, the couch still sagged and the coffee had grown colder. Ava Singh and Caleb Monroe were at the glass watching the corridor. They straightened like kids caught behind the gym. Ava's voice was soft, but could not hide what she had seen. You ran a Pringle in 4 seconds. I have seen attendings take half a minute. Kira dumped the coffee and let the paper cup drop into the bin. Practice, she said. She did not slow. Pierce's voice found her from the doorway of his office. Dr. Shaw. He did not ask her to sit this time either. He stood by the window with Austin low and bright beyond his shoulder. That operation should have taken 3 hours, he said. You did it in 53 minutes. The team did it, Kira said. Do not deflect. He turned from the glass. I have been doing this for 25 years. What you did looked like muscle memory built somewhere I do not understand. Your suture pattern I have only seen in journals about battlefield care. Your packing was not what is taught here. She held his gaze. The fluorescent lights hummed. A plane lifted slow over the city and drew a thin white line in the sky. I am asking you a simple question, he said. Where did you learn that? Rural clinics, she said. Limited resources. He took a step closer. 7 years of your life do not appear on your file. No practicing privileges, no research, nothing. That is not a gap. That is a wall. Kira's sleeve had ridden up a fraction. The tally marks on her arm felt warm under the thin cotton. She pulled the cuff down without looking away. Before Pierce could answer, the overhead speaker cracked alive. The voice was calm and loud and filled the halls all at once. Trauma alert. Multiple casualties. Overpass collapse, Interstate 35 at Riverside. Mass casualty protocol now. All available surgical staff to emergency. Pierce's pen clicked once and stayed open. He looked at her then toward the corridor where the first siren already trembled the glass. They moved at once. The call swallowed the corridor. Sirens pressed through the glass at the end of the hall. The fluorescent hum braided with the sharp beep of monitors and the clatter of wheels. Kira felt the old itch wake under the ink on her forearm. Emergency had been cleared to the bones. Carts parked tight, lines coiled on hooks. The intake doors breathed open and shut. A paramedic shouted over the noise. Overpass collapse. I-35 at Riverside. Multiple entrapments. 37 vehicles. First wave 14 criticals. Pierce planted himself in the center like a pivot. Red to trauma 1 and 2. Yellow to 3 and 4. Green to urgent care. Black to the far hall. Move with purpose. The first gurney slid past. Woman in her 40s with a chest that rose in short, sawed-off pulls. Red. The second carried an older man, eyes rolled to white, a ribbon of blood drying in his hair. Red. The third was a teenager with legs twisted and braced mouth open on a steady scream. Yellow. The room kept filling. Voices layered and dropped. Paper tags swung and flashed color. Pierce glanced at his tablet, then at Kira. Shaw. Yellow tag. Trauma 4. Stable femur fracture. Keep him that way. Kira caught the rail of the assigned gurney as it turned. The patient watched everything with a cool sweep of the eyes. Late 30s, beard a few days old, dust and glass on his shirt. The wristband read Daniel Ortiz. Retired Army was written on the line that asked for occupation. His posture on the board looked like a man who knew how to conserve energy under fire. I am Dr. Shaw, Kira said. We will go quick. Tell me where you hurt. Leg, he said almost wry, middle of the left. He did not ask questions about the chaos. He took it in and filed it away. They wheeled into Trauma 4. Noah King was already there pulling up vitals and clipping the pulse ox to Ortiz's finger. The monitor settled. Pressure 138 over 84. Heart rate 88. Oxygen 98. Respiration 16. Kira ran hands along the thigh. Midshaft fracture of the femur. Closed. No arterial compromise. Distal pulse present. She checked for sensation and movement. Ortiz answered. Steady voice even. The basics were good. She set the stethoscope on his chest. Air moved both sides. The right was a shade quieter. Subtle. Could have been guarding. Could have been nothing. Could have been the start of something that would walk faster than they did. Any chest pain, Mr. Ortiz? He watched her watch him. Not chest pain, he said. A pull. Right side. Had it before. Old injury. A few, he said. He did not elaborate. He did not look away. She looked at his torso. Under dirt and half-dried streaks of blood, she could see pale lines of old cuts that were more about survival than neat closure. Scar maps from a life not listed on a resume. On the right, under the pectoral, the wall lifted a fraction less than the left with each breath. Portable chest x-ray, Kira said. Noah was already waving the tech in. The film plate slid behind the shoulder. Ortiz did not flinch. The machine clicked and hummed. The image came up on the monitor in gray. A small, darker triangle sat at the top of the right lung where air should not be. 15%, Noah said softly. Pierce's voice came in through the overhead in clipped moves. Trauma 1 needs more hands. Trauma 2 is prepped for the elevator. Vascular is paged. The noise in the hall thickened. Kira paged Pierce anyway. He picked up on the 4th ring. Shaw. Right-sided pneumothorax in Trauma 4. Early stage. Oxygen now 96. Respirations 22. Prior chest trauma likely compromised. I would like authorization to place a chest tube. Monitor. Reassess if he worsens, he said. I have 3 red tags trying to die at once. Understood. She slid the phone into her pocket. The hum in the lights sounded like a line being tuned. Noah read her face and set out a tray without asking. You are not authorized without attending, he said. He did not put judgment in it, only weight. He will not stay at 96, she said. He is already rising in rate. If pressure builds, this will go fast. 15 can turn into 30 while we argue. He held her eyes a second. He nodded. I will call it as assisting. Mr. Ortiz, Kira said. Your right lung is collapsing. I'm going to place a chest tube. You will feel pressure and a deep ache. The local will help. Ortiz looked at her and then at Noah. He nodded like a person who understood what consent meant when time was short. Do it, he said. Kira prepped the skin with betadine. The smell rose in a sweet iodine wave that overrode the copper in the air. She infiltrated lidocaine and waited for the blanch to spread under the skin. She marked the 5th intercostal space at the mid-axillary line. Her glove creaked when she rolled her grip on the scalpel. The door swung open hard enough to hit the stopper. Pierce stood in the frame with his cap askew and fresh blood on his sleeves. What are you doing? He said. The words were low but carried. Placing a chest tube, Kira said. His pneumothorax has progressed since the film. Oxygen is 94. Respirations 24. You do not have authorization. We do not do unsupervised procedures. Ortiz turned his head on the board and looked at Pierce with a patient stare that felt like a soldier's stare. She saved my life in a tent in Chiron, he said. Summer 2019. We called the place a forward base. It did not always feel like one. She operated under mortar fire and told me I would get old if I did what she said. Pierce's face went still. He stepped forward 1 pace like the floor had moved under him. What did you say? Major Shaw Ortiz said. He did not add anything. The room did not add anything for him. Noah's eyes cut to Kira and then back to the tube kit. He held the tray a fraction higher. The pulse ox dipped to 91, then climbed to 92, then dipped again. Kira felt the itch under the tattoo flare like heat. She made a small incision. She opened the tract with a clamp. The pleura gave with a soft pop that only the person holding the instrument could hear. The tube slid in against her finger and found the space it needed. She connected to the collection chamber. Air rushed, and the line burped a quick column of pink fluid. The monitor eased. 94, 96. The respiration slowed to count each cycle. Noah tied a suture around the tube with quick, neat loops. He taped it down and wrote the time and initials on the dressing. His handwriting was square and careful. Pierce moved around to the monitor and watched the numbers return to a narrow range. He did not look at Kira first. He looked at Ortiz. You know her, he said. Ortiz exhaled. I knew her hands, he said. It is strange what you remember. Pierce finally looked at Kira. The fluorescent lights caught in his eyes and made small white squares. You were military, he said. It was not a question. Kira kept her voice even. Not now, she said. A burst of sirens bent through the doorway. The overhead cracked again. Penetrating chest trauma inbound. 19-year-old male. Cardiac involvement suspected. Blood pressure 60/30. GCS 4. 4 minutes. The room stilled in the way rooms do when the next wave pulls its breath. Pierce's hand opened and closed once at his side. He looked at Kira and then at Noah and then back at Kira. I need a thoracotomy tray in Trauma 1, Kira said to Gloria, who had appeared without a sound. We need blood at the door. Internal paddles ready. Vascular clamps, rib spreaders, anesthesia to the bay. Gloria had already started moving. She did not ask who would lead. She did not have to. Noah clicked the chest tube into suction, checked the seal, and gave Ortiz a steady look. Stay with me, Mr. Ortiz. He lifted 2 fingers in a small salute that did not need words. Kira scrubbed at the sink just outside Trauma 1. The water ran hot and clean over her wrists. The betadine stain made her skin look like old copper in the light. She could feel the tally marks under the cuff. She did not pull the sleeve down. Pierce stepped in beside her. He washed in quiet. For a moment, the only sounds were water and a siren far away and the old hum that made everything feel familiar. "You think we can save him?" he said. "We will do the work," she said. The intake doors at the end of the bay opened on a rush of diesel and wet asphalt. The gurney cleared the threshold at a run. Blood streaked the sheets. A shard of metal protruded from the left of a young chest angled toward where a heart should be beating. Trauma 1 smelled like diesel-wet asphalt and hot metal. The gurney cleared the doors fast. Blood soaked the sheet. A jag of steering columns stuck from the left side of a young chest angled toward the heart. The lead paramedic spoke while they moved. 19-year-old male, found pulseless, regained twice. Blood pressure 60/30, GCS 4, massive hemothorax, time down unknown. On 3. They counted and lifted. The shard wobbled in its seat. It pulsed dark around the edges. Dr. Ahmed Farouk slid into place at the head, bagging by hand, tube ready. Noah King checked the ventilator. Nurse Gloria Reyes opened a tray with motions that had no slack in them. Instruments flashed under the lights and settled in a clean line. Kira Shaw took the field with her hands already up. "We do this here," she said. "Clamshell thoracotomy, no transfer." Pierce looked from the metal to the monitor to Kira. He held for half a heartbeat, then nodded once. "Do it." Gloria placed a scalpel in Kira's palm. The first cut ran along the left chest just under the nipple line. The second mirrored it on the right. Betadine smell rose through the metallic air. The ribs were tight. The spreaders went in. Metal teeth bit bone. The device creaked when it opened. The chest lifted and became a window. "Pericardium taut," full, Kira said. She could see the sac bulged with trapped blood. Tamponade, knife. She opened the sac with a quick, neat line. Blood poured out in a heavy rush. The heart underneath sat compressed, barely moving, more twitch than beat. Caleb Monroe stepped forward when she glanced his way. "Hands ready. Manual cardiac massage," she said. "Gentle. Keep it steady." Caleb placed his palms and began to squeeze with careful rhythm. The monitor tried to decide what to make of it. Farouk adjusted the oxygen and watched the numbers chase him. The shard still sat like a tooth. It had nicked the right ventricle. Blood seeped with each compression. "If we pull it, bleeding will surge," Pierce said. "We do it on my count," Kira said. "You give pressure direct on the ventricle. Stay on it until I tell you off. Gloria, I need DeBakey's and a small needle driver. Fibrine ready. Combat gauze open." Gloria had the tools before Kira finished the sentence. Noah clipped the suction line to a second canister and cleared the field. Kira set the needle to a crosshatch pattern in her head. She had stitched this shape into more nights than she knew. On 3, 1, 2, 3. She pulled the metal free in one clean move. Blood surged up hot and slick and the field went red. Pierce's fingers were already there, knuckles pale through gloves pressing steady on the ventricle. The rush slowed to a push under his hand. Kira placed the first stitch with the certainty of a signature. Horizontal mattress, then another at a shallow angle, then a third to anchor the tension. The needle kissed the muscle and came out clean. Her hands never floated. They lived where they needed to be. "Pressure is 38/20, Farouk said. "Calcium in, starting another unit." "Hold." "Hold," Kira said. Her voice stayed level. She laid 2 more stitches and cinched the line. The tear narrowed to a dark seam. She painted fibrin over the crosshatch. The bleeding dulled. She packed a strip of combat gauze just outside the suture line to give the clot a place to live. The monitor squealed, then flatline, electrical silence. "Epinephrine 1 milligram IV," Kira said. "Now." Farouk pushed. Caleb kept the rhythm on the heart with hands that were careful and firm. 1 minute passed in a way that felt longer than the hour before it. Nothing. "Internal paddles," Kira said. "Charge to 200, everyone clear." Gloria snapped the paddles into Kira's hands. Kira set them on the heart, one to the right of the repair, one to the left. "Clear," she said. The shock jumped under her palms. The monitor made a sharp mark, then returned to a straight line. "Another epi," Farouk said. He had it ready. He pushed without being told. "Charge 250, Kira said. Clear." The shock rolled the muscle in a small wave and left it quiet. 4 minutes, Pierce said softly. He did not pull his hand off the ventricle. He did not look away. 300, Kira said. "Charge, clear." The paddles delivered. The heart twitched. Once, then again. A weak rhythm stumbled into view on the screen. Beep, pause, beep. The room held still and listened. The rhythm steadied into a narrow run. "We have sinus," Farouk said. "Pressure 70/40, climbing." Kira did not move her eyes off the repair. She touched along each stitch with the back of a forceps and watched for a rise of red that did not come. She lifted the gauze a fraction. It held. She looked up. "Finish the sack," she said. "Wash. Check for secondary injury." Gloria irrigated the field with warm saline. Noah tracked the suction and kept the canister from filling out of turn. Caleb eased back his compressions as the heart took its own rhythm. Pierce lifted his hand and left one small crescent mark where the glove had pressed. "No injury to coronaries visible," Kira said. "Right ventricle repair intact. No other tears. Lungs reinflated. We are good to close." The words did not sound like celebration. They sounded like a checkpoint passed. Pierce stepped in for closure. His stitches were neat and paced. He looked paler than he had at the start. His hands were steady. Gloria counted instruments back into the tray, her voice low and even as she made the numbers fit. Noah watched the oxygen and turned the dial down by clicks until the curve matched the breath. Kira peeled her gloves and walked to the sink. The water ran red for a moment, then pink, then clear. The heat woke the itch along her forearm. The cuff had ridden back during the case. 12 tally marks and a small line of numbers sat in the light. She did not pull the fabric down. Behind her, the beeping settled into a pattern that felt like a room exhaling. Farouk called out the numbers. Pressure 94/58, heart 106, oxygen 91 and rising. The time on the wall clock read 19 minutes from intake to stable. Gloria leaned near the door and spoke just loud enough for the room to hear. "I have been in this bay 23 years. I have never seen a heart come back like that." Noah checked the seals and wrote a note on the chart. "Add one," he said. He did not say to what. Ava and Caleb stood near the glass. Their faces held awe and the blank look of people who had sprinted and only now realized it. Caleb flexed his hands once the memory of the muscle under his palms still in his fingers. Pierce tied the last knot and set his needle driver down. He looked at Kira through the clear pane over the sink. The fluorescent light made a thin halo on the stainless steel. His chin dipped the smallest fraction. It was not an apology. It was something else made of relief and recognition. Kira shut the water off. The room smelled like salt and metal and iodine. She dried her hands with care, each finger in the spaces between. The towel went into the bin with a soft thump. Her pager buzzed against her hip. She lifted it and read the display without changing her face. The conference room smelled like coffee gone cool and new toner. Blinds cut the morning light into even bars across a table that had too much glass. A thin stack of paper waited in the center. Black bars hid whole sentences. The top page carried her name in a font that tried to look neutral. Chief Medical Officer Elena Lang glanced from the file to Kira. Dr. Pierce sat on the far side with a pen he had not used. Legal had a yellow pad. HR had a smile that did not touch her eyes. "We received your service record through defense channels," Dr. Shaw Lang said. "It was not simple." The room listened to paper. Major Kira Shaw, United States Army Medical Corps, Special Operations Surgical Team, 4 tours, 89 documented combat surgeries, 0 preventable deaths listed. She turned a page. Court-martial initiated in Nangarhar 2021 later overturned. Reason for action. Disobeyed direct order during ambush on civilian convoy. Remained under fire, operated on 2 wounded children, saved both. 47 soldiers testified on your behalf. The fluorescent lights above hummed at a frequency that made the edge of the table feel sharp. Kira kept her hands flat on her knees and watched the way dust drifted through the blinds. The coordinates under her sleeve felt warmer than the rest of her skin. Lang's voice softened but did not slow. "Your interventions last week were within the scope of your license, though outside residency protocols. All 3 patients are alive. Post-event review confirms your assessments were accurate and your actions decisive." Legal lifted a pen. "Why did your application omit details that now appear material?" Kira watched the ink on the page more than she watched faces. "I wanted to learn civilian medicine," she said, "without wearing a war on my badge." The pen paused over paper. HR wrote a single word and stopped. Silence settled and made its own gravity. Pierce set his pen down. "I made assumptions," he said. "About age, about experience, About a tattoo? They were not useful. He looked at Lang. We need her where she already is. He did not look away when he said it. Lang folded the top page back. The black bars made a pattern that looked like a city from above. We approve an accelerated track based on equivalency, she said. 18 months. We ask that you lead development of a protocol that integrates field techniques into our emergency practice. You would head training for that work here. Kira felt the hum again. The sound in her bones matched the lights. She nodded once. You see, Gloria Reyes set the sim lab in motion that afternoon. Plastic ribs clicked under gloved hands. The air held the scent of vinyl powder and faint alcohol. Tanya Brooks wore a new badge and an old posture, shoulders set, like someone who had carried too much weight for too long. You are hesitating, Kira said. She stood close enough to watch tendons move under skin. You already know where the space is. Tanya steadied her breath. The scalpel slid. The rib spreaders opened with a soft complaint. Kira guided her left wrist a fraction, turned the driver a degree. Do not chase numbers, she said. Chase bleeding. Tanya's hands adjusted. The move went clean. She looked up like a person coming out of water and finding air exactly where she expected it. Good, Kira said. Again. On the whiteboard, someone had sketched a crosshatch with arrows that pointed to nothing on purpose. Shaw Stitch was written under it in a small, neat hand. Gloria corrected a glove technique with a tap and a look. Noah rolled a cart past with a stack of folders labeled Outreach. He caught Kira's eye for a beat. The look said, Work not, thanks. Daniel Ortiz returned on a Tuesday with a cane he did not use much. A small flyer sat in his hand, a group photo of men with scars and straight backs, and a name that promised connection. He set it on Kira's desk like a calling card. You said I would get old, he said. I prefer older to dead. He did not wait for an answer. He squeezed her forearm gently where the cuff hit ink and walked out into the hall with a gait that had improved since the day air had hissed into the wrong space inside him. Ethan Vo appeared on a Saturday morning with his mother and a grin too big for the hallway. He showed the curved line on his lower left abdomen like a trophy. The color on his cheeks was better. He held his phone with a picture of the scar zoomed in. The camera did not catch the way his breath moved easier. Jordan Rios sent a photo from the step-down unit wires still on his chest like thin white vines. His sister sat at the edge of the bed in a hoodie that swallowed her hands. They both looked directly into the lens. The picture came with one sentence on a folded note left under Kira's office door. Thank you for not quitting. The handwriting was careful and new. The call from Washington arrived when the afternoon heat had turned the parking lot into a shimmering sheet. Kira watched an ambulance back into the bay and settled with a sigh before she answered. Dr. Shaw, this is Director Patricia Hammond at FEMA, the voice said. We have reviewed the outcomes following your implementation. We would like to discuss a national disaster response training program using your methods. Kira let the words fill the line. The lights hummed. A monitor in the hall chimed soft and regular. I can help you build curriculum, she said. I am staying here. That is acceptable, Hammond said. Her tone did not change. We will send a team to observe. She paused. Thank you for what you have demonstrated. The line clicked quiet. Kira set the phone down and watched a paramedic rinse a stretcher with a hose. Water ran in a clean ribbon that broke into patterns across the concrete and then found the drain. Pierce stood in his doorway that evening as the sun pushed orange against the stacked windows of the city. He held a small box the size of a wallet. New badge, he said. He handed it to her, Assistant Director of Trauma. She turned the plastic over in her palm. The photo looked like a person who had not slept much and had not minded. Pierce's mouth worked once before he found words that fit the shape of his face. Do not cover it, he said. Not here. His eyes flicked to the inside of her sleeve and away. He did not say more. He did not need to. She nodded. The sim lab emptied and the floor took on the quiet of late hours. The ER did not empty. It adjusted. Kira walked the length of the unit and watched small things. Ava Singh telling a family what would happen in a voice that made the words hold. Caleb Monroe teaching a med student how to set a shoulder with a grip that did not bruise. Gloria checking a tray and moving one instrument half an inch to make the line straight. Noah on a radio with paramedics, his tone clipped but not sharp, translating chaos into order one sentence at a time. The fluorescent lights hummed like they had always hummed. The sound lived now with other sounds that made sense beside it. Kira passed the glass doors and caught her reflection. The sleeve of her scrub top had slipped back. 12 tally marks and a line of numbers looked back at her. They did not ask to be hidden. The overhead speaker engaged with a small click. Chemical plant explosion, Bastrop County, multiple critical, all surgical staff to emergency. The words crossed the room and took shape in the way people moved. Kira picked up the trauma bag from his hook and felt the weight settle into her hand. Noah fell in beside her at the bend in the hall. He did not need to match her stride, he already did. "Just like old times, Major," he said under his breath. "Better," she said. "We are not alone." The intake doors breathed open. Heat rolled in with a bite of chemical in it, sharp and clean. The first set of wheels rattled over the threshold. Monitors found a rhythm quickly, one chirp answering another across the room. Kira took her place at the head of the bed and met the eyes of the patient coming through the door. The lights hummed, the work began. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.